forgot to add, please pray everyone gets the health care they need in USA. Thanks a lot.
So let's look at some of those models or fixes. I want to call your attention to this one. It's called the mandate model. What does that mean? That means skin in the game. People have to, they have to make a contribution to some big pool so that, so that the people who need it at the time when they need it will have it, and the rest of us will pitch in because we know that at some point we're going to need it too. So there's the individual mandate, there's the employer mandate, where government says, no, everybody has to chip in. That's what we have in Medicare. It is a mandate model too, but we're talking about the rest of the people. So this guy was a big fan of that idea. He wanted everybody, Richard Nixon wanted everybody to buy private insurance. That was his idea of healthcare reform, where they made all those people who were uninsured buy a private health plan product, and he proposed that in opposition to Ted Kennedy's proposal of a single-payer national health insurance plan. And why would Richard Nixon want everybody to have to buy private insurance?
Cash for the
market share. Yeah. So a whole bunch of new customers for private insurance. Okay. So that's basically what we ended up with the Affordable Care Act. We ended up with Nixon's proposal, which is a mandate model, employer and individual based mandate model. And where did that come from? Where were they already doing that? In America. Massachusetts. Yeah, Romney Care, right? So that's what Romney Care was. And so we negotiated away, single payer wasn't on the table at all. We negotiated away the public option. We ended up with Nixon's plan, which was with this one, the mandate model. So how is that performing, or how does that perform compared to other models used around the world, like single payer models, for example, or Medicare for all? We don't do so well. It costs us a whole lot more. We're spending about twice as much on healthcare as all these other industrialized countries. Okay, even our public plan costs us more than their insurance does around the world. And what's the outcome? What's the results of spending all that money? Do we have the best healthcare in the world? No, not by any means. So get ready for that one. People don't come here because we have better healthcare. We don't. In fact, anyone know where we rank in the world? Vern knows. 37. He's busy texting. So we rank 30.
I'm trying to get my son back in the meeting.
He's missing the good stuff.
Yeah.
So we rank 37th in the world. We're tied with Slovenia. So if you want to go somewhere for good health care, you can go to Slovenia. We'll have equal health care with us. Okay? Not my idea of where I want to go for health care, but they have equally good health care. So places like Cuba, for example, has better health care than we do. Taiwan has better health care than we do. People are now leaving America to go get their health care elsewhere. They're not coming here for it. And this is why. You can see we don't live as long as people in all these other countries. And people say, oh, we have bad lifestyle habits and things. We smoke more meat than they do. No, we smoke less than they do. Look at Italy, France, Japan. They all smoke more than we do. They have lousy lifestyle stuff, and yet they're living longer and have better healthcare outcomes. Our infant mortality is worse. Our babies die more often related to childbirth, prenatal care, postnatal care. Our moms, prenatal care, postnatal care, die more often. Look at that, twice the rate of Britain and all these other countries, Canada, 3 times the rate of maternal mortality in Canada. Well, we have a lot of old people we have to take care of. No, they have more old people. Remember, they live longer than we do? Okay, so there's your BS detector right there too. Okay, we don't have more old people. They have more old people. And look at this one. This is completely counterintuitive. This is where we have to do a major kind of cultural paradigm shift in America. They see their doctors way more than we do. We're rationed down to, on average, 4 doctor visits a year compared to Japan, where they have the longest life expectancy. They see their doctors on average 13 times a year. So old people, people with a lot of medical problems and stuff, They make it like a routine, like a weekly thing, a weekly visit. And if you want to invite me back sometime, we could do a movie night or something like that. There's an excellent older movie called Sick Around the World, where this guy goes to different countries and stuff. They have it as part of their culture to see their doctor. Now, who's telling us that we can see our doctors only 4 times a year compared to Japan's 13? Insurance. Insurance is telling you only have so many doctor visits here, okay? And that's restricting your access so that you aren't as well controlled in your medical problems, whatever, if you're on medication or your high blood pressure, you don't have an opportunity to ask questions. Something comes up in your mind right after your visit, you're going to be waiting at least 3 months or 6 months before you see your doctor again. You're going to forget all about it. You won't have an opportunity to talk about what are emergencies, how about end of life expectations, that kind of thing. So people end up in emergency, and seeing me in the middle of the night with end of life considerations. That doesn't happen everywhere else around the world. Uniquely American. Malpractice. They have half the malpractice that we do because they have a relationship with their doctors. They're not nearly as likely to sue their doctor when something goes wrong. They know their doctor. They know that they've been working with them for years, for months, and whatever, weekly basis. There's a lot of trust built up, a real physician-patient relationship. We don't have that anymore in this country. I think we did at one time. That it's gone now. Something called, well, we'll get into that now. So, we don't employ as many nurses as those other countries. They have more personnel to deal with all those more medical issues. We restrict your stay in hospitals more than those other countries. We kick people out of hospitals sooner. So, again, people will say, oh, we don't want to be like Canada where they kick you out of the hospital sooner. Wrong. They keep their patients longer than we do. This is data. This is science. Let's look at Canada for a minute, okay? In Canada, when they started their single-payer system, they immediately started saving money. Okay? They not only saved lives, but they started saving money, and it fell off to about half of the cost that we have. You can see, up until they fully implemented their plan, and you know what they call their plan in Canada? Medicare. That's what they call it. And in fact, they don't even know what single-payer healthcare is, but that's what they have. This is an excellent movie. Again, invite me back for movie night. I'll bring the popcorn. It's called The Healthcare Movie, and it compares Canadian versus American healthcare. And if you ask a Canadian, how they like their single-payer system, they'll say, "What's that?" But that's what they do. They all pay taxes, and actually they consider it to be free. I mean, that's how easy it is for folks to get healthcare in Canada. By the way, the makers of that film, the Healthcare Movie, you've just put that into a web search, Healthcare Movie. You can watch it online. They now have a kind of updated Post-Affordable Care Act version called Now Is the Time. So there'd be 2 excellent movies to watch. Here's a third one. It's called Fix It, Healthcare at the Tipping Point. If you have people who want to be convinced about the advantages of a single-payer system to businesses and the economy and global competitiveness and that kind of thing, this is an excellent movie called Fix It. You can put in Fix It Healthcare. This one you can watch online as well. But let's look at Canada here. They say that our system is more expensive and less productive because of this. They call it our bureaucracy. So we usually think of bureaucracy as the government, right? No. So we have a bureaucracy set up by big insurance and big pharma. And so this is, when people say this system like single-payer healthcare is pie in the sky, I tell them no. It's Marie Callender's pie. If you go to a pie shop and you buy a pie, and you open up the box and a third of your pie or more is gone when you get home, are you going to be pissed? Yeah, that's what's happening right now, is a third of our healthcare pie is gone.
So that's the U.S. Where's the Canada? Is there a pie in Canada too?
This is us compared to Canada. So this is what Canadians, when we compare us to Canada, we are losing this much in our bureaucracy, which is insurance and big pharma. Theirs is 2%, right? 'Cause or 3%. That's, they have a single payer Medicare system. Yeah. This is physician billing. This is the, well, I guess not quite 2%, but you know, our physician billing. So remember, I said about a quarter of all expenses in a doctor's office are due for billing purposes. They have to hire all these staff and stuff. Compared to in Canada, it's very simplified. When you go into emergency, for example, the easiest kind of insurance that you can have in emergency is what's called Medicare, Medi-Cal, right, or Medicaid in other states. So we know that exactly what the government will pay, and they tell you exactly when they're going to pay you. You know, there's no question, there's no haggling with insurance companies, any of that. It's the easiest, most straightforward kind of billing. And that means that they have to have, you know, a fifth or less of the staff to do that billing. People say, well, when you start a system like this, doctors will leave the country to go practice elsewhere. Well, actually, doctors are leaving right now to go practice in Canada because of that simplified billing and all that. I can tell you a pediatric cardiac surgeon who trained here at UCI moved, he tells about how he moved to Canada to practice because everyone heard this story about Jimmy Kimmel's baby. So these are the most heartbreaking cases. These are, you know, these are babies born to young families. Remember, they were sold some high deductible plan. They've got to come up with thousands and thousands of dollars for, you know, multiple heart surgeries, basically. There's a really nice scene in that movie, the healthcare movie, that shows a couple with a baby, just like Jimmy Kimmel's, you know, but they weren't Jimmy Kimmel, this couple. You know, they were two working people who live in Canada. The government, meaning the people, paid for everything. The baby's 4 surgeries. They had to fly the baby from one province to another. The parents went with the baby, stayed in a hotel across the street, and you know, the government, again, paid for their home. I mean, they were both out of work for 3 or 4 months, and they could both stay with the child, and they didn't lose their jobs, they didn't lose their home, and all the medical costs were covered. Okay, that's what you can do when you no longer put up with the banditos. So this shows how doctors at first started to leave Canada. Now they're going to Canada to practice. That's the net loss. So now they're not losing doctors anymore. Doctors are going there because of that kind of simplified process. This is a very interesting slide, especially to doctors. But I like this for public consumption because these numbers don't exist. You can't find them in America. You don't know, I don't know, what other doctors make in salary in America. But in Canada, they know exactly what they make because it's all paid by the government, right? So these are public figures in Canada. Now there's 2 things to see in this, is that one, it's really good money for what are called primary care doctors. And when I show this to primary care doctors, their mouth draws and they say, they make that much money in Canada? You know, so if you're a family medicine doctor, if you're a general internist, a pediatrician, makes almost $300,000 a year, and these are comparable U.S. and Canadian dollars. Psychiatry, that's really good money for psychiatry. I mean, we don't value children very much in this country, right? We underpay our teachers, we underpay our pediatricians too. You know, they can do that. They can change all that when it's we the people in charge, instead of, you know, they the corporate boardroom kind of thing. We could change that so that the primary care specialties made more money. These are what I call the procedurologists. These specialties are doctors who just perform procedures one after the next. They line them up in the operating room in the morning. We got 7, 8, 10 cases going. Hopefully they change their gloves in between cases. But you know, that's what they're doing. It's a mill. They're cranking out the cataracts and all that stuff. The only person who ever called me a communist when I showed this was an ophthalmologist. Because apparently he didn't like the idea of only making, you know, $600,000 a year. Okay? Because that's not John McCain's idea of rich. You remember when Barack Obama and John McCain had the pseudo debate at the Saddleback Church, and they asked Barack Obama how much money was doing well in America? Remember what he said, Barack Obama? He said $250,000. Then Rick Warren asked McCain the same question a week later. Remember what he said? 5 or 6 million. I mean, talk about the divide, the gulf, right? So this is not, you know, this ophthalmologist's idea of rich. But, you know, they value their primary care more than their specialty care, especially procedure doctors. When you look overall at what's the national sentiment for a single payer Medicare for all system, the most current figures here from 2015 shows that it's still a vast majority, 58% of people would like to have Medicare for all. You look at Democrats, it's almost, you know, beyond that, 81% of Democrats recognize that Medicare for all would be the fix. You look at doctors, remember they all say, oh, doctors are not going to stand for this. Wrong. And in fact, we're seeing the AMA coming closer now. Now, how many, what do you think, you know, how many practice, or what percentage of practicing physicians in America you think belong to the AMA, the American Medical Association? We all belong, right? It's like some fraternal order or something, you know, we have to belong or something, professional society. 15%. Only 15%, I know, I get this everywhere. But only 15% of practicing physicians belong to AMA.
You don't hear that figure from them.
Why is that? Yeah, why don't you get that figure from them? Because they don't represent the vast majority of us. They represent those procedure doctors. And they've kept those specialties rare. It's called rarefication, you know, in economic terms. They've kept it rare so that commodity, you're going to pay more money for that commodity by keeping it rare. So the AMA doesn't stand for me. They're getting a little closer nowadays because, you know, people are recognizing that the big baddies here are big insurance and big pharma, and they need to take a stand with the people instead of them. So you look at doctors back in 2002, we were strongly or generally in favor of a single payer Medicare type system. By 2007, it was more than this, obviously more than half. You look at the primary care specialties, that number is about 75% of primary care doctors wish we all had Medicare. When you look at ER doctors, that number is 90%. 90% of ER doctors would like to have everybody have insurance the minute they walk in. Doctors are going to get paid, the hospital is going to get paid. But even better, we know that people had a plan, and so they aren't coming in for junk stuff that they couldn't get taken care of elsewhere. Okay, so let me just cover a few things about the Affordable Care Act. The number of uninsured dropped from like as high as 20% down to about 10%, and with that, you saw commensurate, you know, positive changes. What were the drivers behind it? Young adults could stay on their family plan, as we say, you know, exclusions based on pre-existing conditions, and state exchanges and were set up, and the Medicaid expansion, of course, which a lot of states opted out of. Thank you very much, conservative Supreme Court. Scalia lives on. So what happened as a result? The preventable death rates dropped by half. Is it gone? No. We still have 30,000 per year who are dying preventable deaths in America. And the medical bankruptcy rate didn't change at all. Didn't change. We're still the #1 cause of personal bankruptcy. Here we are 7 years after starting the Affordable Care Act. So these are the drivers for further reform. Should we be happy? Should we be complacent and just say we're fine with the Affordable Care Act? No. We need to do more and better. And we can do more and better, like I was showing you. So the Republicans want to repeal and replace. They want to end Medicaid expansion. Bad idea. Dropping a whole lot of people off health savings accounts and tax credits. That's great for rich people. If you have money to put in a health savings account, great. Who's got money to put in there? Not me. You know, tax credits, that's great. Again, if you're rich, you get more, you know, refund back on your income tax. Okay, that's not for most working people. We fully expect the preventable death rate to double again, and the costs will continue to rise. There's absolutely no cost control whatsoever. So what are the real fixes? John Conyers HR 676, I mentioned. And you can go to this national website, healthcarenow.org, for more information on the national fix. And then down here is our wonderful illustrious California SB 562. If you didn't get a flyer, anyone else need a flyer on SB 562? but it says that everybody in California will have health care. It's a universal health care plan for all California.
Do you have one on the Conyers HR 676 flyer thing at all? No? Okay.
You go to Healthcare Now
Okay.
and get all the information on that. And our website, on your flyer, please go to this website, healthycalifornia.org. It's on your flyer. And sign up. Sign up so that you can be in the loop. We just got it through Senate Health Committee. Yay! Big step. Okay. Next step is California Senate Appropriations Committee. That's huge. But getting it through a Health Committee was huge because we had Democrats who waffled on it, or were waffling on it. And the last time we tried to get this through, we had 6 Democrats who blocked it. And all of them said, oh, Jerry Brown said we shouldn't do it. He doesn't want to sign it. He doesn't want to have to sign it. Jerry Brown said, no, Barack Obama wants us to not do anything because he wants the Affordable Care Act to go in, fully in effect. We've seen it now. We've seen the results of Affordable Care. It's better, but it's not good enough. But we had 6 Democrats block it last time, 5 Latinos, and 1 African American. Why would they do that? Including Lou Correa.
Yeah.
Why would they?
Is the lawyer still in?
No. Who can tell me why? From communities of color, why would they block it?
Cost.
Money.
Yeah.
Money. Because they're taking big bucks from big insurance and big pharma. And they have to do that in districts that don't have big other private donors, right? So in other communities that are wealthier, Democrats can get money from wealthy contributors. But in areas where they don't have the big bucks, you're going to have to raise money like Bernie Sanders did, $27 a person kind of thing, to fight off. The Koch brothers are going to get somebody to challenge, Lou or someone else in this area. So I can tell you, of those 5 Latinos and 1 African American, 2 of them are in jail. 2 of them are now in Congress. One of them is our Secretary of State, and one is the revolving door is now a high-paid lobbyist. So this is political, bad stuff at its worst. And we as activists, as political activists, need to say, no, we need to resist. And the way we do that is to push forward with this bill. This financial study that's going to come out and lead it into appropriation, I can tell you, far back in 2004, this group, a very respected financial institution called the Lewin Group, found that it saved money for employer groups. See the way the bars go down? That means it costs less money. It saves money for all employer groups. Because we're tied in with employment, we'd be untied from employment anymore. So employers would no longer have to provide health care for their employees. And that saves big bucks. Okay, to all employer groups. You have small, medium, and large. And the large employer groups save the most. But why won't they go for it? Because of something called the U.S. Chamber of Commerce, which is tied in with big insurance. So they're not going to allow that to happen. They like things the way they are just fine. Okay? It's going to be small and medium-sized employer groups. And so if anyone can show a friend with a small or medium-sized business, this movie, Fix It, and that will show them and say, sorry, U.S. Chamber of Commerce, our local Chamber of Commerce is going for this single-payer bill. The city of Santa Monica studied this back in 2009. They found they would save $6 million a year by going to a single-payer system. That's a lot of money, right, Dr. Moreno? That's a lot of money in the city budget. $6 million a year they would save, okay, if they went to a single-payer system. The state of Vermont would save $5 million for their 500,000 population. I mean, we have, what, almost 2 million people in Orange County alone?
500 million. You said 5 million. 500 million it says there, right?
I'm sorry, 500 million, right. $500 million for their 500,000 patients. And that's a true indicator anywhere you go. Okay, so you can, as a state, in California, we have how many people in California?
Many.
34. 38, I think now, 38 billion people. We would save 38 million people, we would save $38 billion a year in our state budget, just by the number of state employees that we have. But all businesses would save money, too, because they're no longer tied Healthcare is no longer tied to employment. It's based on a progressive taxation system. So locally, this is our campaign here in California, the Campaign for a Healthy California. I mentioned that. And then this is our new champion, Senator Ricardo Lara. If you haven't seen him at, like, say, at the Senate Health Committee, he's brilliant. This guy, I had no idea that he's that brilliant. And he, you know, led the discussion there at the hearings. And then also there's Senator Tony Atkins from San Diego, Michael Leidy, who's the policy director for National Nurses United and California Nurses Association, was their expert witness on the pro side. On the opposition side were some industry baddies like Kaiser, for example. I worked for Kaiser for 30 years. How can you work for Kaiser? Yeah. So, but anyhow, they were certainly, you know, it was a fiery discussion, and it's worth watching. And they had this phenomenal parade of individuals who came all the way to Sacramento to say that they were in favor of the bill. And then, you know, of course, 3 people in suits come out to say they're opposed to it. I can tell you that we lobbied Josh Newman, Janet Nguyen, John Morlock. I've been to meetings with their staff locally, all of them so far. We have one coming up with Pat Bates. Josh Newman waffled on it. Josh Newman abstained from voting on this. Says he wants to see the financial, you know, projection. I'm happy to show him my PowerPoint. Everybody in here is now smarter than Josh Newman on the subject, because, you know, if it's true, and I always say when you know, and I think Sharon Court Silva said the same thing. You know, if it's true that they don't know, then they're, you know, I'm sorry, ignorant on the subject, or they're lying. And that either one of those things are good, and we want them to be, you know, smart and in favor of these things that will benefit the people.
What Janet Nguyen do on it?
She voted no. She's an absolute no. Okay, both two Republicans. There are only 2 Republicans on the committee, and they both voted no. Josh and another Democrat abstained altogether, but we got 5 votes, which was the majority, including Senator Ed Hernandez, which is not, he has not been found previously, and now he's running for lieutenant governor, and I highly recommend you go to his website and consider endorsing Ed Hernandez. Now, he's become a champion.
Josh just wants to see what the financial mechanism in the bill, exactly how it's going to work.
So,
and that's not worked out yet.
The legislative process is you go through the policy stuff first. That's what a health committee is policy. Then it goes to appropriation. So the financial has to be done before appropriation. That's the money. That's where you work out the financial stuff. So I'm sorry, I don't accept that as an excuse for him not voting for it, or Janet Nguyen for that matter, because it was just a matter of policy. Is this a good idea for California? Absolutely. Could it be blocked in appropriations? Sure, if the numbers don't work out. We have a financial study being done right now by an analyst who's very friendly with Jerry Brown. They were chosen because they're friends. And so we expect the numbers to come up, as they always have, in our favor, that it will save money. As you know, single payer saves money. Okay, so the numbers will come out in our favor, and then they're going to have to find another excuse to not vote for it by the time of appropriation, or when it goes to the Senate floor, and it can be blocked at either point now. So Josh didn't have to waffle on this. He could have supported it in concept, the policy of it, and didn't. In my opinion, I think that was a mistake, and we told his staff that 10 days before the vote, that we thought he should be a champion for this too. But once this is passed, it will go to the Assembly, in which case we will want or expect Sharon Silva to do better. I'm happy to sit down with her anytime. Pardon?
You're talking about 562.
SB 562. Yeah, the Healthy California Act.
Dr. Bill, about Tom Daly, where is he on
Don't know. So we haven't
Tom Daly.
Yeah. So when you go to the website healthycalifornia.org and sign up, you'll be part of the you'll be in the loop as to what the next strategic point is. And so right now we're going committee by committee. We're way far away from the Assembly at this point. We're encouraging people to contact their Assembly members and ask them that same question. I guarantee you they'll dodge it. No, we have a few co-sponsors already from the Assembly side. If you look up the legislation, you'll see there are a few co-sponsors already. He's not one of them. Yeah. Not that I know of. He's not one of those he's not a co-sponsor, and he's not on this committee. I think he may be on appropriations, but he was not on health. Yeah.
What was the answer about Bailey?
Don't know yet where he is. And he's on the Assembly side, and that's a ways away yet. But, you know, they expect the floor vote. The appropriations will be at the end of this month, and the floor vote will come up the first part of June. So, I mean, now is the time to call Josh, if you live in his district especially. But even if you don't, these folks are voting for things that affect us all. So when they tell you, oh, you don't live in the district, you just say, I don't care, I live in the state. They're voting on a statewide law. I'm going to give you my opinion. And they'll usually back down at that point and take your opinion. Yeah.
Like when you're talking about healthcare, to me, the big thing is, how do you pay for it? That's been the downfall of the Affordable Care Act. Everything.
Yeah, that's the Thanksgiving dinner question, you know, like your Trump voter uncle, you know, Billy Joe, he will ask you the same question, right? How are you going to pay for it? What's the answer?
How do you pay for it?
What's the answer? It's the free calendar's pie. We're already paying for it. We're just not getting what we paid for.
Yes, but how are you going to pay for it? I mean,
we're already paying for it. So when you apply the money that we're already paying in terms of private and public insurances, then that pays for not only what we get now, it will also cover dental, mental health, long-term care, all those things that we don't get now. That's how. So now, if you're talking mechanism, it's a progressive taxation system, meaning by ability to pay. So those who have done well in American society, you know, in our capitalist system that we have, they're going to be expected to chip in more. Okay. So it's income tax and payroll tax, at least in this state.
The other half is.
Yeah.
I think I've gone over my time, so I got to, and I know everybody wants to talk.
But this is a simple question.
Yeah, go ahead.
It appears to me that this represents destruction of the entire healthcare system.
No, absolutely not. It does not. It destroys the payment side, which we have allowed these banditos to control. So that's just the payment side. Doctors, nurses, hospitals will function exactly the same way. Kaiser would function exactly the same way.
So we will still use the same delivery?
Not only that, you will have free choice. There will be no more in-network provider stuff. You can go see any doctor. You can go walk into any hospital and expect to get care. You can go to, you know, anything. If Kaiser's such a great model for providing care, then they can compete based on the care they give, not on some insurance product they offer. Okay?
Okay.
Sorry, I have lots of questions.
Now, Canada transitioned to this system in the 60s or thereabouts?
So they passed it about the same time we passed Medicare for seniors, they passed Medicare for all. So it's mid-60s. By 1970, you saw, was when they fully enacted it, about 5 years later. And none of this we're doing for ourselves, by the way, if you're old like me. I see a few young people here. We're doing this for young people because it'll take a while to transition.
So prior to that, they had a system similar to what we have today. Okay. So what was it? What was the catalyst? What got
So watch this movie, the healthcare movie. It's all about that. It's a wonderful a preacher from Prairie Province, Saskatchewan, named Tommy Douglas, who started this in the 30s, and by the 60s they got it.
And recently he was voted the greatest Canadian of all time, wasn't he?
Right. Because he recognized that it wasn't right, it wasn't morally right. And this is not about right versus left, it's about right versus wrong. This is actually non-partisan. This is where right and left meet around back. Okay? And he recognized that. And Republicans, conservatives, like their system too and value it too. You saw that in Michael Moore's movie. This guy on the golf course said, Michael Moore asked him, he said, "You're a conservative, why would you like the public health plan?" He said, "Hey, how do you think I got rich? I know a good deal when I see one."
I have an acquaintance I know that lives lives in Canada, and she had a torn meniscus, and she wanted to get it done. And because there was such a waiting list and time, she ended up coming down here and having it done.
Yeah, so, sorry,
How does that
but
all work?
overall, they don't wait any longer than we do. And you will hear stories like that over and over again. And I realize it's averages and stuff, but they don't wait any longer than we do. And you saw, they live longer than we do. Okay? So it might apply to having your knee fixed or your hip, done, replaced or whatever. But overall, they live longer and have better health outcomes than we do. And if they were waiting longer for their care, would they have better outcomes? No. So I can tell you that as an emergency doctor, there are things you can wait for and things you can't wait for. And when it's the people deciding what those things are, instead of some corporate bottom line, then you can do a whole lot better, and we will do a whole lot better. Yeah.
Okay.
Okay. Thank you very much, everybody. Please go to the website. Thanks.
Thank you.